I'm the Executive Director of the Wisconsin Community Action Program Association. Thanks for joining us today. We only have a brief amount of time this morning, so our purpose is not really to get into the policy weeds as such, but these will be outlined in various organizations' position papers, and there's a hearing at noon today that will dive into that in greater detail. Rather, today what we are here to do is express our broad concerns about the overall tone and direction of these proposals, and most importantly, provide an opportunity for those most directly affected by these proposals and offer or speak directly to the potential impact of the legislation. As I mentioned, I represent WISCAP. It's a statewide association of 18 local community action agencies. We operate in every corner of the state, rural, urban, suburban alike. And our tripartite board structure of low-income households, members of government, business community, and civil society perhaps gives us a somewhat unique and important local perspective. That is, our member agencies see poverty in its many forms and understand what is necessary to address it. And when we speak of poverty in Wisconsin, we're referring to the fact that 1 in 10 Wisconsinites live below the official line, that a roughly equal number suffer from food insecurity, that working full-time at minimum wage does not correspond with housing affordability, and that over 18,000 children and youth are homeless across our state. These are very sobering numbers. And because of this, more than 65 organizations who work with struggling individuals and families across the state have come together to express our concerns about these bills, and you will find circulating our statement to that effect with the organizational sign-ons. We certainly support good jobs and living wages. I think we agree with the governor and the bill sponsors that that is the best way out of poverty. But we also know from the Institute for Research in Poverty's annual report of the crucial role that safety net programs play, programs such as Food Share, and what these programs play in terms of poverty reduction. Taken together, it is our genuine concern that however well-intentioned this package of bills might be, they do not address the very real barriers to employment, be those housing, transportation, or childcare, and instead ultimately reduce supports while leaving people to the vagaries of the marketplace. That is, they represent requirements without an attendant provision of resources. So today we are releasing a joint statement calling on the governor and the legislators to set aside the bills, to invest in proven solutions, and before proceeding further, hear from individuals and families across the state about what they really need. And we can modestly start that process today by hearing directly from people who experience the effects of the kind of public policies that are created in this very building. So with that, I'd like to introduce our first speaker, Sharice Daniels from Watertown. Sharice is the daughter of a retired Navy vet. She works at a family resource center and serves on the governor's Early Childhood Advisory Council. Sharice?
Good morning. My name is Sharice Daniels. I live in Watertown, Wisconsin. I'm the daughter of a retired Navy vet. I didn't really know what struggling was until my parents got divorced my senior year of high school. My mom worked 2 jobs, my sister worked at a bank, and I worked at a daycare. We were still barely making ends meet and struggling to support one another, even with all of us working full-time, because wages were too low to meet our financial obligations, but too high to qualify for assistance. These circumstances were not easy for me growing up. They were definitely not easy for my mother, and they're certainly not easy for the countless of families that I serve. Currently, I am a program instructor at a family resource center. I have trained agencies and nonprofits about strength-based approaches to engaging parents and families. I even serve on the governor's Early Childhood Advisory Council. And yet, my family still struggles, and we regularly walk a fine line between making a little too much and not making quite enough. For us, it is the difference between eating balanced meals, spending time as a family not exhausted and burnt out from all the work that we've done during the week, and not being able to afford extras that most people take for granted. It makes me, as a mom of 4, have to work even harder to navigate many of those same systems to keep my own family afloat financially while I juggle work. It also impacts our state's kiddos as they come to school with 2 backpacks every day. the burdens that their families struggle to overcome, and the expectations that they must meet or exceed while their livelihood hangs in the balance. Making the process to get a little bit of assistance when it's even more complicated did not help my family. Passing laws that put in place more hoops and hurdles will not help families that I serve. It does not help to put up more barriers for families who are already constantly navigating a delicate and tightly woven system to get their most basic needs met. It does not help to assume the worst about struggling families without even asking them what they need to get their families on more solid ground. And rather than giving families tools and telling them to fix themselves, we should be empowering them. Oftentimes, the families I've served have been forced to make the unimaginable choice between going hungry, going to the doctor, quitting a job because breaking even to pay childcare costs isn't sustainable. Families like mine and the families I serve and talk to every day need reliable transportation, affordable and accessible childcare, real job skills training and education, and jobs that don't pay poverty wage. More hoops and hurdles without real help is not what will stabilize families and our state's kiddos. I'm here to ask today that we pursue real solutions that we know work and that we know struggling families like mine really needed, not bills that punish and make hard choices and hard realities even harder. Thank you.
Thanks, Charisse. Next, we will hear from Courtney Waller of Williams Bay. Courtney is the mother of a child with a very rare illness, and she utilizes food share and Medicaid to make ends meet. Medicaid, sorry.
Thank you for allowing me a chance to tell my story today. My name is Courtney Waller. I am from Williams Bay, and my family does receive food share and Medicaid. This isn't because, as some may suggest, I'm not interested in working. In fact, I've worked 2 jobs my entire life. The reason I'm unemployed is that one of my children has a rare disease, and I'm her full-time caregiver. Keeping her alive and thriving, that is my job. In 2013, Theodora Elise came into the world with Timothy syndrome, an ultra-rare disease affecting only 20 children worldwide. The diagnosis carries a long and multi-system list of health and neurological problems, most of which can be managed with medication. Theodora appears to most to live her life like a normal 4-year-old. There's always the danger of sudden cardiac arrest, which is the leading cause of death for her syndrome, a syndrome that carries a life expectancy of only 6 years. There are many barriers to my ability to find and retain employment. Theodora sees 7 specialists. These specialists are not available during after hours, on weekends, and most often are not in clinics on the same day. The clinic best equipped to care for her is an hour and a half from our house each direction. This alone amounts to many hours of missed work per appointment, with appointments with each specialist ranging from a few weeks apart to 3 months apart. Timothy syndrome affects her immune system as well. As the youngest of 4 children, Theodora is exposed to countless viruses and colds. In her siblings, and in most children, these illnesses last a couple of days. For Theodora, they have often meant 10 or more days in the cardiac intensive care unit on oxygen and unable to take the medications most children can because of the effects they have on her heart. This also equals many days and many hours of missed work, sometimes several days a year. Finally, in the 4 years since her birth, Theodora has had 6 surgeries. There are more that will need to be scheduled as she ages, and there are others, like her last heart surgery, that will come as a complete surprise, an emergency call from the doctor telling us to come and she will be in surgery within hours. Again, many hours and many days of missed work, sometimes with no warning. Prior to Theodora being born, I spent 20 years in managerial and executive positions in the restaurant industry. I understand personally the challenges to employers in having an employee that requires so much time off, especially when they have very little warning. Since Theodora was born, I now understand the challenges to parents of children with medically fragile children in adequately being not only being able to perform their jobs, but also being able to arrive and show up for their jobs. If I'm lucky enough to find employment that is very forgiving of her medical emergencies, appointments, and surgeries, for Theodora, I must have specialized care. There are many school-age children with medical conditions like Theodora's who do not attend full days of school, which reduces the numbers of hours available for work even further. If I was to return to work, I would need qualified care, which would come at an expense through the state and at taxpayer expense. It is imperative that any work requirements considered by the Assembly must take into account families like ours and barriers to finding employment. To do so otherwise comes at the expense of not only families like us, but of employers and of taxpayers. Thank you.
Thank you, Courtney. Our next speaker is Bianca Shaw from Milwaukee. Bianca is a mother and a worker whose struggles help explain the many challenges that people face.
Hello, and thank you so much for being here today and listening to and also receiving the stories that we're sharing with you. My name is Bianca Shaw. I live in Milwaukee with my 6-year-old daughter, Olivia. We live in Sherman Park, and I work full-time. I am not here today to ask you for a hand up or a handout. Some legislators and the governor seem to be asking families like mine to pick ourselves up by the bootstraps. Well, I've picked myself up by my bootstrap time and time again. And I tell you that making the decision to break a generational cycle of poverty and work myself off of benefits is not as easy a task as you seem to think it is. Reaching self-sufficiency is a struggle that I face every single day. I'm in need of a support system that allows women like me to work ourselves off of benefits, and unfortunately, the bills proposed today will not help me or others like me around the state do that. Here's my reality. I work hard. I thought I was getting myself somewhere when I obtained a job that paid well above minimum wage. But my net monthly income was only $2,100 per month. I earned $374 too much for Wisconsin Shares child care, which left me to pay $1,100 per month in child care costs. Added to that, $150 for health care, plus $200 per month for food. Our rent is $700 per month, and I couldn't afford my car and auto insurance if I was to pay for quality child care for Olivia. So that supposedly good job that I received, it meant that I put myself in a position of having to choose between reliable transportation and quality child care because my budget would not allow for both. We experienced regular food insecurities, and I experienced levels of stress that caused me health issues as well as relationship issues. To legislators supporting these bills, I ask that you think about what it's like to have to choose between child care and transportation, even when you're working hard and full-time. I ask you think about what it's like to have to feed your child ramen noodles 3 nights a week because you live paycheck to paycheck. Think about what happens to families like mine when we enter a crisis and we have to choose between paying our rent and paying our energy bill. Before you make assumptions about what we need and propose legislation that's based almost entirely on judgments and assumptions and stereotypes, I ask that you genuinely ask us what it is that we need. I can tell you that I need parental supports, including access to quality child care for Olivia, my child, and other children like her. I ask that you give this to me and allow me to have this while working one position. I need that one job to pay me enough to meet my basic needs, and maybe save a little for her education and enough to have for emergencies when they come. I ask that you help me get reliable transportation so I can get myself and my daughter to and from school. I ask that you make Wisconsin employers pay a decent wage that will allow me to work one job full time and provide quality and stable housing for myself and my daughter. I need these supports far more than I need drug screening and additional hoops and barriers you're proposing that will keep me and my child from having a little extra help with getting nutritious food on our table and meeting our basic needs. I ask that you think of Olivia. Think of her as your child. Think of me as your sister. We are one Wisconsin. We are responsible to one another. It is our responsibility to put in place the best and proven solutions, not ideas, that make it even harder for people like me who are already working so hard to pull ourselves up by our bootstraps. Thank you so much.
Thank you, Bianca. And Olivia is very beautiful. Our final speaker is Karen Treadwell, who's the Executive Director of the Food Pantry of Waukesha County. Karen?
Thank you for the opportunity today to speak to you and on behalf of all the people that we serve at our food pantry. Even in the more affluent counties in our state, far too many working people and their families struggle to make ends meet. For example, the food pantry of Waukesha County, one of 13 pantries in our county, serves more than 5,000 individuals each month. Close to 40% of the people served are children. Their parents often need to rely on public and private resources in order to ensure that they and their children have adequate nutritious food and the other essentials needed to live and thrive. More than 11% of those served are senior citizens, and many of the other people served have chronic illnesses or other disabilities. The dramatic changes proposed on the state level to essential assistance programs will weaken an already vulnerable population's ability to move ahead or to even meet basic needs. Taking food share away for not complying with a failed program like FSET will not help struggling parents get a job or find transportation in a county with very limited public transportation. We need to ensure that parents have access to quality training and education, childcare, and reliable transportation that will help them to get and keep a job. I have been the executive director at the Food Pantry of Waukesha County for 20 years. My experience has shown that each time there are additional barriers to food share and other basic needs programs, the use of community pantries intended for emergency use or to supplement other resources increases. The additional barriers decrease access to basic necessities and do not help people find and keep work. We need thoughtful solutions that lift, support, and empower individuals in our communities. These bills, unfortunately, will only make it harder for already vulnerable people in our communities to access the essential assistance they need. Thank you.
Thanks, Karen, and thanks to the four of you for very powerful and very real stories. Again, on behalf of the 65-plus groups who have signed on to the joint statement being released today, we're asking that these bills be put aside and instead for legislators to hold hearings throughout the state in order to get feedback from those like our four speakers this morning. As discussed, there are proven effective paths out of poverty, and we owe our communities and our neighbors the respect of having that important discussion. And with that, I think we're going to throw it open to some questions. I'm surrounded by many colleagues who represent a very wide cross-section of organizations that deal with these issues. You've heard from our speakers. I'm going to duck out. There's a hearing today at noon on this package of bills, and I trust there'll be plenty of opportunity moving forward for us to continue to be available to discuss the proposals and the implications. Thank you. Questions?
So Karen mentioned FSET as a failed program. I'm wondering if somebody could talk a little bit about their experience with FSET and why you think the program is failing.
Certainly, I can share some of thank you. Some of the information that's been provided to us through the people that we serve. And of course, this is anecdotal, personal stories that have been shared. For example, I know of a woman who went through the FSET program and was trained and provided training that was to make her eligible and trained for specific jobs, and in which case she ended up getting a job that she was clearly not ready for. And because of the deficits in the training, she was not able to keep her job. And we've heard from those sorts of situations many times. And I think Hunger Task Force will have some more information that's more specific about statistics.
Sure. I can tell you for every one person that has gotten a job on FSET, 9 people have lost food assistance in the state of Wisconsin. The ResCare, which is a FSET provider for a number of counties in Wisconsin, has had civil rights issues that have been raised by the USDA, by the Department of Justice. The Department of Health Services have had issues with informing people correctly. And the folks that we help every day that come to pantries and food programs and meal programs report to us that they want help, right? That they'd like training. What these bills do today is disincentivize any training for folks. It cycles people in and out of temporary jobs and really puts sort of a primary goal of getting people job after job after job, instead of talking about training people, about providing real solutions. We have a fantastic technical college system in the state of Wisconsin. We need to use those programs to provide people a pathway out of poverty.
Can you identify yourself?
Sure. My name is Maureen Fitzgerald. I am the Director of Advocacy at Hunger Task Force in Milwaukee. The spelling of my last name is Fitzgerald.
Can you talk a little bit about the training you're talking about? Why is it deficient?
Sure. So what we've heard from folks who have gone through the training, and I can tell you that I've gone through the original orientation that was provided by ResCare in Milwaukee. It's standardized, right? So instead of getting an individual employability plan, what you're getting really is an online ResCare Academy that is only in English, that really doesn't provide specialized or individualized training for folks. And what we find is really temporary jobs being utilized frequently instead of providing people, say, CNA training or training that might lead to a pathway out of poverty.
Sure. I would just like to say that I feel that FSET it has been a failure to a lot of families like mine, specifically because the positions that we're trained for, CNA, housekeeping, these are jobs that historically black women enter and become stagnant in. STEM is the way of our future: science, technology, engineering, and math. So if we are going to use taxpayer dollars to train a future of people, it should be for careers that are actually rewarding and will help individuals work themselves off of benefits. My specific story, when I became $374 over the poverty income guideline, I was initially kicked off of Wisconsin Shares, which is provided as a subsidy for child care. My daughter did go to a quality child care service that was $1,100 per month. That essentially put me well under the poverty income guideline, and the recommendation from the FSET worker was to find a more affordable child care service for my child, which is not an option for me. So I feel that the FSET program fails us by not actually looking at what it takes to raise the entire family. So we are punishing children for things that parents may or may not do. So I really feel like the FSET program has the ability to help individuals work themselves off of benefits, but right now it's designed for either you are totally dependent upon the system or you're struggling trying to make it without.
All right, thank you, everyone.
Thank you.